My name is Bridget Hay, and I would like to share a presentation on my practicum experience at Ascension Via Christi with my preceptor, Christy Martin. To give a little bit of background on Ascension Via Christi, St. Francis and St. Joseph campuses. St. Francis is a level 1 trauma center. They do have a PEDS-friendly emergency department, PEDS unit, and PICU. They have air ground transport. Some other service lines include a burn center and cardiac rehab. They have a full imaging and laboratory services offered. They are a regional stroke center with a 24/7 neuro interventional services. St. Joseph campus has the labor and delivery unit. They also have a neonatal intensive care unit. They have forensic nursing and also inpatient behavioral health. So to summarize my role as a practicum student, I worked under Christy Martin, who's the director of clinical informatics. I saw how Christy and her department collaborate with an interdisciplinary team, multiple interdisciplinary teams, I should say. And then I worked on an applied learning project to support the development of a new power plan for blood and blood product ordering. So to review my applied learning project, the issue with ordering blood has been discussed for a very long time at Ascension Via Christi. So what I did was took a lot of notes from many different groups have been working to address the issues with blood ordering. It was pretty apparent that there's a lot of confusion with blood on hold and then when to give those units. So we gathered and organized notes from multiple past work groups, and we helped to consolidate that into one streamlined workflow map. And then that streamlined workflow map helped the creation of a new order plan for blood products and include 2 new orders to transfuse now and a new order to hold transfusion. So we took our mocked up new power plan to St. Joseph for feedback to our nurses and some residents who were there. And then we took that feedback and presented our new power plan to Ascension Nursing Leadership, the Director of Laboratory Services for all of Ascension, and a Program Manager for Nursing Practice. So to kind of summarize the key feedbacks that we got from nurses, they generally liked it. They really appreciated the clarity of the 2 new orders, transfuse now versus on hold. Their concerns was the wording for the new orders sounded too similar. So we took that feedback back to our work group to discuss, and we ended up creating a different worded order. Our residents overall liked the new power plan. They thought it would be pretty easy to implement, but they did notice a communication order that was in the prior power plan was missing. And so we also took that communication back to our work group and our build team to put that order back. So our feedback that we got, we took that back to our Ascension Nursing Leadership. And we did get a final approval for the terms transfuse now, and then our second order will be whole transfusion. And that seemed to be clear and everybody liked that. Then the plan for the new power plan will be for Via Christi to implement, and then they'll consider that for a broader Ascension-wide rollout. They're going to look at Via Christi for their updated policy and process, and then take that for an Ascension standard. They really liked the power plan and really thought it solved a lot of the complaints that all these different groups have been working on to address. So it was really exciting being involved in a lot of that process of workflow mapping and the creation of the power plan, and then taking that power plan for feedback. And it was just mocked up. I don't think it's ready just yet, but it's in the works. So my next section, I'd like to talk about how my practicum experience has prepared me for my next steps in healthcare leadership. Um, a lot of my experience with Christy Martin, I saw a lot of department collaboration. Informatics works with every department. They support technology, workflows, and reimbursement strategies, for example. They have a big focus on improving patient-centered care. My leadership observations I had with Christy Martin, I observed how Christy fosters a positive and effective culture. Informatics plays a crucial role in guiding change, and her supportive leadership creates a ripple effect across departments. I really appreciated seeing all that from her. Professionalism and practice. What I learned by Christie's modeling, professionalism was caring, being insightful and supportive is very important in healthcare. Informatics requires diplomacy and solution oriented mindset. And I seem to grow in my integration of data, technology, and workflow is essential. My experience really grew on how essential all of those complexities work together. Business skill and knowledge. I gained experience in navigating regulatory, financial, and compliance issues, saw the importance of strategic planning, and gain awareness of the financial impacts of clinical decisions. Healthcare environment really needs focus on efficiency, resource management, and quality care. Informatics plays a supportive but vital role in all of the healthcare organization, and they truly work to help clinicians provide safer, more effective care. And I feel like I grew in all of that as well. So, what are preparations for what's next for me? This practicum and the Masters of Healthcare Administration overall really broadened my understanding of the complexities of healthcare. Um, I really want to help address the challenges that make healthcare so challenging. And and there's a lot of opportunities in healthcare. And I feel like my next steps may lie in maybe an elected governmental role to really help drive meaningful change. So I really appreciate my experience with Christy Martin and my practicum, and I'm excited for what's next. Thank you so much.